Metoclopramide, brand name Reglan Mitonia, dosage 1 ampule, for the root through IV, frequency given as needed. Classification: under therapeutic class, it is antiemetic. For the pharmacology class, it is dopamine antagonist. Mechanism of action: it stimulates motility of upper GI tract and black dopamine or serotonin receptor in chemoreceptor trigger zone. The patient was given this medication because metoclopramide is an antiemetic agent and dopamine D2 antagonist used in the treatment of gastroesophageal reflux disease, prevention of nausea and vomiting, and to stimulate gastric emptying. It was given to the patient to prevention episodes of vomiting and diarrhea, since the patient is experiencing severe diarrhea and vomiting. Contraindicated in patient for whom stimulation of GI motility might be dangerous, those with hemorrhage, obstruction, or perforation. These are the list of side effects: anxiety, drowsiness, dystonic reactions, fatigue, lassitude, restlessness, seizure, akathisia, confusion, depression, dizziness, fever, hallucinations, headache, insomnia, bowel disorder, diarrhea, and nausea. Nursing responsibilities: monitor bowel sounds. Discontinue drug if signs and symptoms of tardive dyskinesia develop. Monitor patient for involuntary movements of face, tongue, and extremities which may indicate tardive dyskinesia. Monitor patient for dizziness, headache, or nervousness after metoclopramide is stopped, as this may indicate withdrawal. Ferrous sulfate, brand name Ferratab and Ferrosol. Root oral, dosage 1 capsule, frequency twice a day. Classification: under therapeutic class, it is iron supplement. Pharmacology class, hematinic. Mechanism of action: provides element iron, an essential component in the formation of hemoglobin. Ferrous sulfate was prescribed to patient to help her body to make healthy her red blood cells, which carry oxygen around the body. These are the list of side effects: nausea, constipation, black stool, diarrhea, and GI discomfort. Nursing responsibilities: tell the patient to take tablet with water but not with milk or antacid. Instruct patient not to crush or chew extended release form. Advise patient to report constipation and change in stool color or consistency. Calcium gluconate, route IV, dosage 10% or 10 ml for slow IV push. Classification: under therapeutic class, calcium supplement. Pharmacology class, calcium salt. Mechanism of action: replaces calcium and maintain calcium level. Calcium gluconate was given to patient because she is experiencing hyperkalemia, which the potassium level increases. Therefore, calcium gluconate was administered to correct potassium level of the body. Contraindicated in cancer patient with bone metastasis and in those with ventricular fibrillation, hyperkalemia, and renal calculi. Side effect: tingling sensation, bradycardia, constipation, hemorrhage, nausea, vomiting, thirst, and abdominal pain. Nursing responsibilities: monitor calcium level frequently, sign and symptoms of severe hyperkalemia, tell patient to take oral calcium with a full glass of water, tell patient to report nausea, vomiting, constipation, abdominal pain, dry mouth, and thirst. Ferrous sulfate elixir, brand name Feusol, route given orally, dosage 5 ml, frequency twice a day. It is classified as an anti-anemic drug. The mechanism of action: it is an iron combines with porphyrin and globin to form hemoglobin. Ferrous sulfate elixir was prescribed to patients to increase hemoglobin and regulate RBCs. Also, it helped in iron absorption. Side effect: diarrhea, constipation, abdominal discomfort, and nausea. Nursing responsibilities: monitor hemoglobin and reticulocyte value during therapy, monitor bowel movement as constipation is common adverse effect. Continue iron therapy for 2 to 3 months. Hemoglobin level return to normal.
We have paracetamol. The brand name is Dynadon, Lemsip, Panadol, Panamax, and Tylenol. The route of administration is per orem. The dosage is 500 mg. Frequency is twice a day. And the classification of this drug is non-narcotic, analgesics, and antipyretic. Mechanism of action: it decreases fever by inhibiting the effects of pyrogenson, the hypothalamus heat-regulating center, and by a hypothalamic action leading to sweating and vasodilation. Paracetamol was administered to the patient to correct the altered body temperature, since kidney failure can affect the temperature of the body.
Contraindicated in patients' hypersensitivity to drug. Side effects: nausea, stomach pain, loss of appetite, itching, rash, and headache. Nursing responsibilities: if there is fever, assess patient fever or pain. Give drug with food if GI upset occurs.
We also have here Epotin, or the brand name of Epogen. The route of administration is via IV, and the frequency is 3 times a week. The classification of this drug under the therapeutic class is colony-stimulating factor, and under the pharmacologic class is recombinant human erythropoietin. Mechanism of action is a glycoprotein that stimulates red blood cell production, and Epotin medicine was prescribed to the patient to treat a lower than normal number of red blood cells caused by a chronic kidney disease in patients on dialysis to reduce or to avoid the need for red blood cells transfusion.
Side effects: a rapid increase in hematocrit and hemoglobin may cause hypertension and thrombotic complications. Nursing responsibility: control BP adequately, notify physician as a rapid rise in hematocrit, monitor closely for thrombotic event.
And the next drug is cholecalciferol. The brand name is vitamin D3. The dosage is 1 capsule, oral, and it is twice a day. The classification is fat soluble. The mechanism of action: the activated form of cholecalciferol binds to vitamin D receptors and modulates gene expression. The vitamin D3 was administered to help balance calcium and phosphorus in your body by controlling absorption of these minerals from the food you eat, and regulates parathyroid hormones.
Side effect: headache, confusion, constipation, dry mouth, high level of calcium in the blood. Nursing responsibility: discontinue if the patient become hyperkalemic. Avoid taking magnesium supplements or magnesium-containing antacid. Early symptoms of hyperkalemia.
And we also have here a plain normal saline solution, or the plain NSS, a 0.9 sodium chloride solution, or the brand name Slow Salt. The route of administration is via IV, and for the dosage is 10 gouts per minute. And the classification is isotonic solution. For the mechanism of action, normal saline is a sterile, non-pyrogenic solution for fluid and electrolyte replenishment. Plain normal saline solution solution was administered to restore fluid volume because they fill the tissues and maintain fluid volume more effectively than hypertonic or hypotonic solution. For the indication, solution is used for replacement, treatment of metabolic alkalosis, a priming fluid for hemodialysis to begin and end blood transfusion.
Contraindicated in patient with congestive heart failure, severe renal impairment, condition of sodium retention, edema, liver cirrhosis, and irrigation during electrosurgical procedures. Side effects: hypernatremia, injection site swelling, hypokalemia, acidosis, electrolyte imbalance. Nursing responsibility: check doctor's order, regulate the flow as ordered, obtain history of the patient's fluid, watch for signs and symptoms of fluid overload, monitor for sign of infiltration.
We also have here nephrocaps, or the generic name ascorbic acid. The dosage is 1 tab per day per ORM and once a day. Classification is vitamins and minerals combination. The mechanisms of action: this product is a combination of B vitamins used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, alcoholism, or during pregnancy. Nephrocaps was ordered to work on metabolic functions of the kidney and to maintain levels when dietary intake of vitamins is inadequate or excretion or loss is excessive. And indication: in the wasting syndrome in chronic renal failure, uremia, impaired metabolic functions of the kidney, and to maintain levels when dietary intake of vitamins is inadequate or excretion of loss is excessive, also high effective as a stress vitamin.
Contraindication: iron metabolism disorder causing increased iron storage and low amount of potassium in the blood. Side effect: mild upset stomach, allergy reaction, and severe dizziness. Nursing responsibilities: assess patient for side effect of allergic reaction. Assess the patient for sign and symptoms of vitamin deficiency. Administer vitamins with food to promote absorption. Advise client to take prescribed amount of vitamin.